That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear a discussion between a doctor and nurse about hypoxemia and its causes. Now read the question.
Hello, doctor. What is hypoxia and what are its causes?
Well, hypoxia means low oxygen but is described as a deficiency in the amount of oxygen that reaches the body tissues. Hypoxia differs from hypoxemia, which means an insufficient amount of oxygen in the blood. In hypoxic hypoxia or hypoxemia, the tissues do not get an adequate amount of oxygen since there is a lack of oxygen in the blood flowing to the tissue. Generally, hypoxic hypoxia is caused due to inadequate breathing and other causes. In anemic hypoxia, low levels of hemoglobin lead to a decreased ability of the blood to carry the oxygen that we breathe in. Therefore, the tissues get a diminished supply of oxygen. The stagnant hypoxia or circulatory hypoxia is caused due to inadequate blood flow resulting in less oxygen supply to the tissues. In histotoxic hypoxia, the tissues are incapable of utilizing the adequate amount of oxygen available, despite the adequate oxygen inhaled through the lungs and delivered to the tissues. Metabolic hypoxia occurs when there is excessive demand for oxygen by the tissues than usual. Oxygen may be absorbed, transported, and used properly by the tissues. However, due to a condition that raises metabolism, it is still insufficient. Sepsis is a perfect example of this.
You hear a lecture about the disease called botulism. Now read the question.
Botulism is a serious illness caused by the botulinum toxin, which causes paralysis. Paralysis begins in the face and spreads to the limbs. When the condition reaches the breathing muscles, it can result in respiratory failure. The toxin is produced by a type of bacterium called Clostridium botulinum. Foodborne botulism occurs by eating foods contaminated with botulinum toxin. Common sources of foodborne botulism are improperly canned, preserved, or fermented foods. Wound botulism occurs if the spores of the bacteria get into a wound and make a toxin. Patients who get injections have a greater chance of getting wound botulism. Iatrogenic botulism occurs when excessive botulinum toxin is injected for cosmetic purposes, such as for wrinkles, or for medical reasons, such as for migraine headaches. Infant botulism occurs if the spores of bacteria enter the intestines of an infant. Adult intestinal toxemia botulism is a very rare kind of botulism that occurs when the spores of the bacteria enter into the intestine of an adult, grow, and produce the toxin. Generally, patients with severe health conditions that affect the gut may be more likely to get this disease.
You hear a discussion about gastroesophageal reflux disease. Now read the question.
Doctor, what are the different causes of gastroesophageal reflux disease?
Gastroesophageal reflux disease, or heartburn, is caused in many different ways. If the lower esophageal sphincter dysfunctions, then the lower esophageal sphincter will not close completely after the food reaches the stomach. Stomach acid will then back up into the esophagus. A hiatal hernia occurs when the upper part of the stomach is thrusted upwards into the chest through an opening in the diaphragm. This occurs due to a weakening in the diaphragm or due to increased abdomen pressure surges with obesity. This opening is called the esophageal hiatus or diaphragmatic hiatus. It is considered that a hiatal hernia weakens the lower esophageal sphincter and causes reflux. When a patient has a motility disorder or slow stomach emptying, is caused due to a problem within the muscle itself or a problem with the nerves or hormones that control muscle contraction. Over 50% of the patients with gastrointestinal reflux disorder have the abnormal nerve or muscle function in their stomachs, resulting in impaired motility. Esophageal irritation is caused when certain types of food, drink, smoking, and medications can directly irritate the lining of the esophagus. In such conditions, it makes a difference to take the pill with a full glass of water and to stay upright after taking medicines for about 30 minutes.
You hear a discussion about congenital myopathy and its types. Now read the question.
Hello doctor, what is congenital myopathy and what are its types?
Congenital myopathy means that a person is born with myopathy. Sometimes a hereditary medical illness does not develop symptoms until a person grows into an adult. Mitochondrial myopathy is caused by a defect in the energy-producing part of the cell called the mitochondria. There are several types of mitochondrial myopathy that are caused by hereditary mutation abnormalities in the genes. However, they can also occur without any family history. A metabolic myopathy is a group of diseases caused by metabolic problems that interfere with muscle function. Generally, this condition is caused by defects in the genes that code for certain enzymes that are essential for normal muscle movement. Anemolan myopathy is a group of disorders characterized by the presence of structures called nemolan rods in the muscles. Nemolan myopathy is often linked with respiratory muscle weakness. Central core myopathy is an inherited disease causing weakness, bone problems, and severe reactions to some medicines. Muscular dystrophy is a group of diseases caused by degeneration of the muscle or abnormality formed muscle cells or abnormally formed muscle cells. The main difference between myopathy and muscular dystrophy is that muscles do not function properly in myopathy, whereas the muscles degenerate in muscular dystrophy.
You hear a discussion about primary brain tumors. Now read the question.
Hello doctor, what are the types of primary brain tumors?
Well, there are many types of primary brain tumors that are named according to the type of cell or the part of the brain in which they start. For instance, most primary brain tumors begin in the glial cells. This type of tumor is called a glioma. Among adults, the most common types of brain tumor or astrocytoma tumor arises from star-shaped glial cells called astrocytes. It can be any grade in adults and astrocytoma. Most often arises in the cerebrum. Oligodendroglioma tumor begins from cells that make the fatty substance that encases and protects nerves. It usually occurs in the cerebrum. Oligodendroglioma tumors can be either grade 2 or 3. Meningioma tumor begins in the meninges. It can be grade 1, 2, or 3. It's usually benign at grade 1 and grows gradually.
You hear a discussion about different types of aspergillosis. Now read the question.
Doctor, what are the different types of aspergillosis?
Well, aspergillosis is a disease caused by aspergillus, a common mold or a type of fungus that lives indoors and outdoors. Commonly people breathe in aspergillus spores daily without getting sick. However, people with weak immune systems or lung diseases are at higher risk of developing health problems due to aspergillus. There are different types of aspergillosis. Allergic bronchopulmonary aspergillosis causes inflammation in the lungs, and allergy symptoms such as coughing and wheezing, but doesn't cause an infection. Allergic aspergillus sinusitis causes inflammation in the sinus, and symptoms of a sinus infection are drainage stuffiness or headache. In the cutaneous aspergillosis, as spillages enters the body through a break in the skin and causes infection, usually in patients with weak immune system. Aspergilloma, also called a fungus ball. It is a ball of aspergillus that grows in the lungs or sinus but usually does not spread to other parts of the body. Chronic pulmonary aspergillosis is a long-term condition that lasts for about 3 months and that can cause cavities in the lungs. One or more fungal balls may also be present in the lungs. Invasive aspergillosis is a serious infection that usually affects patients with weak immune systems, such as organ transplant or a stem cell transplant patient. Invasive aspergillosis most commonly affects the lungs, but it can also spread to other parts of the body.